Good morning, everyone, and welcome to our CAG Quarterly Digest webinar. I'm Danielle Chenal, and I am a director and senior consultant with Inspire Innovations. And Inspire Innovations is a proud member of the Managed Care Resource Alliance. Today I have with me Margaret Crowley. She's a lead consultant with Inspire Innovations, and Caitlin Potozak. She's a business analyst with CAG Solutions. So just a few housekeeping items. First, we will send the slides and a link to this recording to all the attendees after the event. If you have any questions, you can put them in the online chat. You can also subscribe to our YouTube channel, which is where this presentation will be housed. So the topic for this quarter's focus is DSNP. And Margaret is going to be talking to us about updating passively enrolled members and the effect that that will have on processes and reporting. So again, save any of your questions for the end. You can put them in the chat, and I'm going to hand it off to Margaret. Thanks for joining us, Margaret.
Hey, thanks, Danielle. As Danielle said, I am lead consultant for Inspire Innovations, and we'll be talking today about passively enrolled DSNP members. So I'm going to take you first through some, just a little bit about the program itself. So a quick summary. So any of the plan's Medicaid members turning 65 in participating states can be passively enrolled in a DSNP plan, and we will go through what that means, passively enrolled, as we go through the session today. All enrollments with an effective date on or after January 1st would be eligible. And it must be processed in accordance with revised requirements, including the new model Medicare Advantage enrollment form for the 2021 plan year, starting October 5th, 2020. Okay, so now we're going to talk a little bit about what is passive enrollment. So the beneficiary would receive a notice of the change that they have been enrolled in this DSNP plan, and they'll have the opportunity to accept or decline it. So if the individual takes no action after receiving the notice, passive enrollments are permitted in specific limited circumstances associated with immediate plan terminations, situations in which remaining enrolled in the plan would pose potential harm to members, and situations where CMS determines passive enrollment is necessary to promote integrated care and continuity of care for full benefit dual eligible beneficiaries. And that's really the one I think is most going to come up. So CMS evaluation of plans receiving passive enrollments. So they must operate as a fully integrated eligible SNP or a FIDA SNP to meet Medicare, Medicaid integration criteria as a DSNP that meets a higher standard of integration. It must be substantially similar provider and facility networks between the Medicaid and Medicare plans, substantially similar Medicare, Medicaid covered benefits. They have limits on cost sharing that are appropriate for full benefit duly eligible beneficiaries. They must have an overall MA star rating of at least 3 stars, and they must have the capacity and agree to accept enrollments. So I think a lot of this is going to become clearer as we walk through the case study. So if it's a little confusing, hang on. Okay, so here's our case study. So it's going to be a mid-sized plan that has one existing DSNP contract. They are located in New York State. That's important because this is a combination CMS state program, so states may have different rules around this. So this particular plan is in New York State. And just the things we looked at. So we always look at process, people, and systems. So some of the considerations we looked at were enrollment, notices, customer service training, appeals and grievance processing, and appeals and grievance reporting. So let's walk through those. So under enrollments, so the plan's going to receive a monthly list of eligible Medicaid members from the state. So when a member is turning 65 or about to turn 65, they will be on this list that's going to be sent to the plan, and the plan knows those are the members they can take action on to passively enroll them into the DSNP plan. So they're going to enroll members in an existing DSNP plan. So the DSNP plan already exists with the members, so these passively enrolled members are going to go into that same plan. The plan will update the member records, indicate Medicare dual as primary and Medicaid plan as secondary. Plan and delegates must process requests for services authorizations using covered Medicare and Medicaid benefits. So again, that's just some of the enrollment things that we needed to look at. Then the notices, of course, so the plan's going to mail notices to the qualified individuals, notifying them of default enrollment. Again, the notice will provide information on how they can opt out of that, so the members are not required to be enrolled in this program. And also we need to look at the letters to make sure that they included language on both Medicare and Medicaid information. So customer service trainings. This is important because this is where a lot of the appeals are going to start. So it's important that this team knows how to recognize and what to do under different scenarios. So the first one is the enrollment disenrollment process. Again, they need to know these letters are going out and someone may call to disenroll on the plan or have questions on why this was done. How to select the correct preference for the appeal track. And we're going to talk a little bit about that next as far as what track Medicare or Medicaid this case can use. And also how to process a member who wants to change the track. And again, we'll talk a little bit more about that as we move forward. So appeals and grievances processing. So we had to evaluate process flows, obviously, and I'm going to quickly walk through a couple of those in the next slide. We added a flag to the system to indicate passively enrolled DSNP members because it's treated a little differently. We have a flag so anyone looking at the case at that member record would know that this is a passively enrolled member. And we obviously had to update standard operating procedures. A lot of it's around what track this case would take. So again, I'm not going to read the whole thing, but I do kind of want to look at this as an example of one of the things you're going to do to look at people, process, and systems. So we started with intake. So this is customer service or a external company that may process your mail-in requests from members. Okay, what Medicare G&A would do with the case. So if the case is routed to Medicare, which is probably going to happen by default. So if I'm a customer service rep, and the member does not state which appeal rights they want to use, I'm going to see a DSNP contract number or Medicare contract number, and it's probably going to go to Medicare. So from their point of view, they're going to send it to Medicare. If, however, the member states they want to use Medicaid appeal rights, then they would route it to the Medicaid team. So that's really determined by what the member says or doesn't say in that call. So now we're going to look at what happens when this case gets to the G&A team. So as we said before, most likely, unless the member specifically indicates they want to use their Medicaid appeals rights, it's going to go to the Medicare triage team since the member will have a DSNP contract number that will be recognized as a Medicare member. So the triage team in the Medicare group would look at a couple of things. So the first thing they'll look at is the service. Is the service covered by Medicare? If it is not, regardless of what else may be on the case, they're going to need to send it to the Medicaid team to process since the service wouldn't be covered. If the service is covered by Medicare or by both, then they need to look at the case notes again to see if the member did indicate a specific track. So for example, if the member asked to use their Medicare appeal rights, that would automatically indicate they're going to keep the case. And if the service is covered by both, but there is no indication of which appeal rights to use, the default is going to be Medicaid. And that was determined really by working with the state. So then we're going to look at reporting. So now we have cases in different, using different appeal rights, so we need to look at reporting. So Medicaid-only services are reportable to the state. Obviously, if a service is Medicaid-only, it's going to use Medicaid appeal rights, and the state needs to know about those. Similarly, Medicare-only services, so if the service being appealed is only covered by Medicare, it's going to go down a Medicare appeals track and get report to CMS. Where it gets confusing if you have a case that crosses over in the middle. So part of this program is that the member can indicate, as we said, which track, which appeal rights they want to use, but they also have the option to change it. So say, for example, a member called in and said, I want to put in this appeal, or they wrote a letter, I want to add this appeal. I want to use my Medicare appeal rights, and the case gets started as a Medicare case. And they call customer service back and say, you know what, I was looking at my materials and I want to change my mind. I'd really like to use my Medicaid appeal rights. So in that case, we need to report them to both CMS and the state. So again, we have to look at what happens in your system. So in this particular instance, the Medicare case would be closed as withdrawn because the member is basically withdrawn and being processed as a Medicare case. And a new case is started under the Medicaid appeals rights, where the date the member requested that change is the new company received date. So again, that's something, a process that needs to be worked out with customer service, how they handle that, and with the GNA team. There was also a new requirement for 45-day reporting. So if a passively enrolled member's case is still open at 45 days, the state required notification of that. It was determined that there is a monthly Medicaid report that is sent to the state, and this information could be added to that report. So again, from a system standpoint, we had to make sure that that was a column that was going to appear in this report. Okay, so now we're going to go to Q&A. Kate, do we have any questions that came in on the chat?
Yes, we do. Hi, I am Caitlin. We have 2 questions from our audience. The first question, my compliance team was saying we need to report all of these cases to both CMS and the state. So can you talk a little more about that?
Sure. So I would ask the compliance team or urge them to call the state just for their own comfort level and because the state may have different regulations. So in the case of this client, again, we're talking about New York State. They did contact the state. So CMS states that if the member is using the Medicaid track, it's really a Medicaid case. So it's not reportable under ODAG, CDAG. So that sets up with them. As far as state reporting, again, the state of New York said that if a case is a Medicare case and the member is using Medicare appeal rights, they don't need to know about that. But again, the compliance group was also a little hesitant, so they contacted the state just to get that confirmation.
Okay, thank you. And question number 2. The final revised ODAG CDAG changes were recently announced where there are new reporting requirements specifically for DSNP contracts. Are there any considerations needed for passively enrolled members?
That's a good question. So we're in the process of making those updates now. So haven't had specific discussions around passively enrolled DSNP members. However, since CMS determined that a case where the Medicaid appeal rights were being used, either because the service isn't covered by Medicare or the member has indicated they wanted to use Medicaid appeal rights, or there's no indication, in which case it defaults to Medicaid, those don't need to be on ODAG CDAG. So this ruling should not change that because the case at that point becomes a Medicaid appeals rights. It's not under the auspices of Medicare. It doesn't use those timeliness criteria. So it wouldn't be included. So it shouldn't affect that. The only note I would say is the system that you use for reporting should be able to exclude those cases. So again, if you're using the contract number to pull those cases into reporting, you have to be able to exclude any that were processed using Medicaid appeal rights. And that may be in different places in your system.
Okay,
Anything else,
thank you,
Kate?
Margaret. Nope, that was, there was only 2 questions.
Great, thank you.
Great. So thank you, Margaret. Thank you, Caitlin. And thanks for everyone for joining us. Again, if you want to reach out to us, you can check out our website at inspireinnovations.com. We have other videos on our YouTube channel where this video will be posted as well. And again, we appreciate your time and look forward to talking with you again next quarter.